Pain in your Achilles tendon? Stop. Let's talk some options. I'm Dr. Adam Fields. I'm a chiropractor. I use the Piezowave technology to help people with chronic and acute Achilles tendinopathies. Your Achilles tendon is amazing. You run, you jump, it takes stresses, it absorbs the load, and then it gives it back to you and springs off. I mean, the Achilles tendon allows you to run and jump and play volleyball, etc. But what happens is your Achilles tendon actually goes through some degrading, and then it regenerates, and that happens on a regular basis. There is something called a tenocyte. The tenocyte is a cell in your tendon that communicates with your collagen to create this load tolerance level and so that it handles the intense loads that you're putting upon it. In fact, there's even a neurological signal that helps it with that, and that's part of the regeneration and the rehabilitation process of the Achilles tendon. But what happens if that adaptation doesn't happen, or if that load tolerance level is overcome, or even there's repetitive stresses that the healing process doesn't have time to happen. A person is running every day uphill, doing sprints, and it doesn't have time to heal.
This is my daughter Nadia. She's been dancing for almost 10 years, at least 10 years now. And in January of last year, she was struggling with ankle pain. And after a series of doctor visits and an MRI, she was diagnosed with Achilles tendonitis.
So often what happens, you get peritendinitis or inflammation around the tendon. And that inflammation continues, and then what happens is you can get what's called a tendinopathy, which is not, we call it Achilles tendonitis, which was kind of a misnomer, and a lot of people say, well, it's tendonitis, therefore I need some cortisone. But the cortisone's a problem because it actually can decrease inflammation, which really, this isn't inflammation, it's tissue damage. It's like fraying. Cortisone can lead to tendon rupture. I think it's very dangerous. I don't think we should be using it for Achilles tendons. I'd much rather use the Piezowave. And so most of the time, that tendon has a problem about 2 to 6 centimeters from where it attaches to the calcaneus. And that's the most avascular region of your Achilles tendon. And that's usually, I mean, you need blood for things to heal, so it doesn't heal as well there. So what we do with the Piezowave is we send low energy, focused shock waves into the area, and they go in and they can actually, if there's any scar tissue in there, they will break up the scar tissue, and then you get neovascularization or angiogenesis, new blood to the area. And there you have that blood that helps things heal, right?
It hurt a bit at first during the treatments, but then it slowly got better and I was able to increase the intensity. And I appreciate that I'm able to track my progress. And then it felt so much better once I got back to class and I was dancing again.
It feels like something is happening when you're getting this treatment. You'll be able to tell the person that's doing it on you, okay, I feel that, and with the focus shockwave, you're actually going to be able to dial in exactly where you need it. There's something else called radial shockwave, which is a different waveform, and we would have reps come and use it on us and literally get bruised and get scabbed. This is not like that at all. This is focus shockwave, much more expensive machine, but we can dial it in exactly where we need it. And the operator matters. The person who's doing it on you matters, because with Achilles tendonitis, with Achilles tendinopathy, better said, there's oftentimes concomitant problems. There's other things that are going on, sometimes a peroneal tendon, a tibialis posterior tendon, or there might be a cyst in the area. So you really have to know what you're doing to work with the Achilles tendon. Other things with this particular machine, it's just point and shoot. But Achilles tendinopathy, I highly recommend somebody who really knows the anatomy, who's worked with this before. Let's look at some of the research on this because it's really exciting. High-energy extracorporeal shockwave therapy as a treatment for chronic non-insertional Achilles tendinopathy. They concluded shockwave therapy is an effective treatment for chronic non-insertional Achilles tendinopathy. Okay, there's also something called insertional Achilles tendinopathy, which is right where it connects to the bone. Let me give you a research article on that one. High-energy extracorporeal shockwave therapy as a treatment for insertional Achilles tendinopathy. Extracorporeal shockwave therapy is an effective treatment for chronic insertional Achilles tendinopathy. Local field block anesthesia may decrease the effectiveness of this procedure. This is important because the last two studies I just read were on high energy extracorporeal shockwave therapy, whereas we're using low energy. And they're saying that the anesthesia can play a role in inhibiting the healing process. Next study. Shockwave therapy induces neovascularization at the tendon-bone junction. Very cool, right? Neovascularization, new blood supply, and what they say is shockwave therapy induces the ingrowth of neovascularization associated with the early release of angiogenesis-related markers in Achilles tendon bone junction in rabbits. Those guys use their Achilles tendons, that's for sure, all that hopping around. The neovascularization may play a role to improve blood supply and tissue regeneration at the tendon-bone junction. So here's another study on the high versus low ESWT. Shockwave therapy for Achilles tendinopathy found that in rat Achilles tendons with low energy shockwave therapy restored biomechanical characteristics of healing tendon, while high energy shockwave therapy resulted in inhibitory effects on repair. The great thing about low energy shockwave therapy is there is no ill side effects. It's only healing. Here's a good one. Extracorporeal shockwaves promote healing of collagenase-induced Achilles tendonitis. Tenocytes at the hypertrophied cellular tissue and newly developed tendon tissue express strong and proliferating cell nuclear antigen. So they had these rats and they enzymatically degraded their Achilles tendons, and then they put the low energy extracorporeal shockwave on there and they regenerated the tendons. Isn't that amazing? I love geeking out on this science. Let's read another one. 2020 study, extracorporeal shockwave therapy for Achilles tendinopathy. They looked at 8 studies on this one, and they came up with ESWT improves pain and functional outcomes in patients with Achilles tendinopathy.
We definitely would not be here today if it wasn't for Dr. Fields. The piezoelectric shockwave therapy that he has been doing on her ankle has been instrumental to her getting back on stage and dancing. She just successfully completed our Nutcracker season, and she was Clara, and she did an amazing job. Definitely would not have been able to do it without the therapy that we've received.
So if you have degeneration of the Achilles tendon, why further degenerate it with corticosteroids when you can regenerate it with the Piezowave? And pair this with some good isometric contractions, some eccentric contractions down there at that level, and now you have a recipe for a new, wonderfully functioning Achilles tendon. I know this is a challenging problem. You've stopped running, you've stopped walking up hills, you saying, I can't go to the gym, but let's start the process back again.